Hi, I'm Dr. Sonia Malik from Nova Fertility, Delhi, and there are certain common queries regarding IVF or what we know as in vitro fertilization, which you all have, and I thought I would just try and talk about what is bothering you all the time when you come to us. So there is a considerable amount of awareness about IVF now in the country, and we all know that this is the actual the medical term used for test tube baby. So if you have a problem where you have been asked to go through this process, you should understand what it means and what scares you most. You should understand that and not feel scared of this procedure, because there is nothing harmful and nothing so difficult about it. So let me just go through it right from the beginning. When you have been advised IVF, there are certain indications for which your doctor would have said so. The first step is that you are made to go through a certain number of tests, which are called the pre-IVF testing, and that is to make sure that you are not suffering from any kind of disease or a medical disorder which might interfere with the formation of the eggs when we are making the eggs for you. And second step therefore is, the first step is of course that, and there is an intensive screening for infections which can be passed, like hepatitis B and for HIV, etc., so that we are absolutely clean and we can go ahead and start making your eggs. So the next step is basically to start making the eggs, and for that what is important is it doesn't take long, and it takes about 9 to 10 days to form the eggs. Here we are forming more than one egg and multiple eggs. So therefore you are going to get injections. In the first 5 days, generally you will get 1 injection per day, and then in the next 5 days, out of a total of 10, you are going to get 2 sets of injections, one maybe in the morning and one at night, or maybe both together. So, but that is the only difficult part of IVF. I repeat, that is the only difficult part, the number of injections that you would be getting in these 10 days. And after that, we have to do a oocyte retrieval or an egg retrieval. Now this process is always done under anesthesia, which is a short anesthesia, something like what they give when they are doing a dental extraction or a dental treatment for you. And then you're given anesthesia for 15 minutes. The eggs are extracted from your body by pricking the ovary with a needle and sucking them out. Once that is done, you will remain in the hospital for about 2 hours till you are totally awake and the effect of anesthesia has passed out. And then the lab work begins. Your eggs are crossed with the semen of your husband, and then the embryos are made. So the embryos take about 48 hours to start forming, and your doctor would tell you when she's going to transfer the embryos, whether it is on the 3rd day or on the 5th day, or sometimes even on the 2nd day, and sometimes they are not going to transfer the embryos and just freeze them. So these are the different types of IVF programs that you will understand when you're going through them with your doctor. If you have to have an embryo transfer, that is a very simple procedure which is not done under anesthesia, and a very thin cannula or a tube is passed into your uterus and the embryos are placed into the uterus. So that is done under as awake, not under anesthesia, and you go back home in about 15-20 minutes, or maybe 1 hour of rest, and then you are sent back home. And then you are given a set of medications, you are given instructions to wait for your pregnancy test, and we always hope that you come back with a positive pregnancy test. So that is what is IVF. It's not difficult at all. Thank you.